Yvonne Ndege is a spokesperson at the International Organization of Migrants. She joins me now from Nairobi. Yvonne, good to have you on the program with us. First off, when we talk about a migrant, who are we talking about here? And globally, what do the numbers look like?
Well, IOM, the International Organization for Migration, estimates that there are over 272 million international migrants. And when we talk about migration and migrants, it's a combination of factors, it's a combination of types of people. Of course, primarily in people's minds, they first think about people who simply move from one country to another. But migrants also include those who are caught up in war and conflict, for instance, internally displaced persons. Of course, it also includes millions of refugees around the world. It includes persons who have been caught up in trafficking and people smuggling. So it's quite a broad range of individuals. And IOM basically works with migrants to try and ensure that countries around the world, governments around the world, accord migrants the same opportunities, the same rights as ordinary citizens. Obviously, migration as an issue has been with humanity since the beginning of time. And on this day, which is International Migrants Day, IOM, the International Organization for Migration, is really asking people around the world to reimagine migration as something that is potentially beneficial to all of society and humanity by first responding to the needs of migrants, many of whom find themselves in very vulnerable situations.
Yeah, and to your point there, I know a lot of people, when we talk about migrants, think about crowded migrant camps and refugees, but whether it's forced or voluntary, I know migrants do make a really significant contribution, don't they?
Well, that's right. And the COVID-19 pandemic has really shone a light on just how crucial this act of human mobility, the ability to move, is so important. You talked a bit about the situation and the opportunities and the benefits that migration can bring. And what we have seen during the COVID-19 pandemic, particularly in this region where I am, Eastern Horn of Africa, is that there have been hundreds of border closures, obviously air, land, sea, land crossings closed, which has stopped millions in their tracks, hundreds of thousands of people in their tracks. And of course, this has had a devastating knock-on effect on many economies that are heavily dependent on the migrant worker. On the ability of individuals to move around the world to different nations, to different countries, and to work. We've seen in many parts of the world, in several continents, a huge drop in remittances, the cash that people send back from jobs they have abroad to people, to the homes and villages where they come from. So yes, the benefits of migration are well documented and well known. And what IOM, the International Organization for Migration, is advocating for, particularly because of everything that we've seen during the COVID-19 pandemic, is for migrants to be included, okay, first of all, in the response to the COVID-19 pandemic and the benefits of migration and the impact of the pandemic on migrants to be responded to, realized and responded to, and obviously solutions found.
How much concern is there that with the pandemic and now the availability of vaccines, that migrants will be left out of countries' vaccination programs?
Well, this is of enormous concern to IOM because, as many will know, many of your audiences, the migrants we are serving and working with, I talked about internally displaced persons, I talked about refugees, are people who have found themselves in situations where they are predisposed to conditions and circumstances which may lead to the spread of the pandemic. Usually those will be informal settlements, overcrowded settings. They may not be able, of course, to do the social distancing that many of us are doing in the developed world. They may have a lack of access to personal protective equipment. And IOM, the International Migration Agency, has been calling on governments around the world as they respond to the impact of COVID-19, as the vaccines begin to be developed, and given to people, that migrants are included and prioritized, I would go as far as saying, in this response, simply because they are living in circumstances, many of them, and conditions where they may not have access to adequate healthcare. They may be in conditions that could see the disease, re-emerge or resurface. And so when we talk about the COVID-19 vaccine, we believe that the COVID-19 vaccine or vaccines should, of course, be accessible to, of course, the most vulnerable among us, internally displaced persons.
Okay, we'll leave it there. Yvonne and Ndege in Nairobi, thank you.